We're going to do another cardiac case. You guys are all ALS, and you get the following information. You're dispatched to a house where you got a 12-year-old boy. The complaint comes in as he's having lethargy, tachycardia, and a racing heart. The kid is 12 years old, and they tell you he weighs 50 kilograms. Parents are at the house, and you guys are dispatched, and you may begin.
Okay. All right. So, starting off with the usual BS vaccine safety.
You got it.
The number of patients is one. We have one 12-year-old boy. Tachycardia, no?
Tachycardia is present, and he's also lethargic.
Tachycardia,
and complaint comes in as a racing heart.
Got it. Okay. We'll consider additional resources, but we got quite a few hands on deck right now, so we'll cross the bridge when we come to it. As always, we'll consider sequence hospitalizations, but we don't know if he's had any trauma yet.
Yeah,
so
we're going to say we don't know yet. Yeah.
So, coming in, what's my general impression?
Okay, so you're asking for the PAT, right? Pediatric
Right.
Assessment Triangle.
The activity, appearance.
Appearance, breathing, and circulation. So, appearance, he is moaning, minimal response to you or the caregivers. On breathing, he has increased rate and effort, which includes nasal flaring, so he has accessory muscle use. And then on circulation, he has pale and mottled skin.
Pale and mottled? Okay. Let me try to get a AFCU on him.
He does not respond to verbal, but on pain he moans.
Okay, so response to pain. Is the airway patent?
Airway is now patent, but you definitely see he has accessory muscle use when he's breathing.
Does he accept opiate?
He does not accept an opiate. Does not.
What's his work of breathing? It's do I see a lot of accessory muscle usage?
You do. You see nasal flaring. His rate is about 34 a minute, and he has saturation of 92% on room air.
Okay. Let's.
What else do you want to do in the breathing assessment?
For breathing, lung sounds. Let me listen a couple places.
Yeah. Use your stethoscope. Right. There's one there. So on breathing, you notice there's crackles throughout lung fields. Crackles throughout lung fields. So what do we listen to? Mid-axillary, right? Mid-axillary. Mid-axillary.
All right. You know, with the crackles, with the accessory muscle usage, let's just go ahead and his rate is elevated, no?
His rate is elevated, 34 minutes.
Let's go ahead and start the bagging.
All right.
On oxygen, please. And then circulation, CTC?
CTC, he has pale and mottled skin.
Pale and mottled? Okay. And then
and his capillary refill is 6 seconds.
Cap is 6 seconds. Radio pulses on this case?
They're very thready, but they're present.
Okay. All right. Well, we obviously have a sick kid. Let's keep pushing forward.
Okay.
Let me go ahead and hook him to the monitor and get a set of vitals on him.
All right. Your blood pressure comes back 75/55. The monitor, he could turn it on. Yep. And then the rhythm that you see, that's the rhythm that you got.
Analyzing heart rhythm.
And we place the monitor into AED mode, right? So remember, we always want to place it into the on position. Right? So coming here, right, what's your interpretation of this rhythm?
That is an SVT.
Okay, very good. We're going to say your heart rate is 235, even though it says 217. We're going to say it's 235.
Okay.
Based on do you still have your algorithms for the PALS? You have your booklets? Can you give them the algorithms if you guys have any? Which algorithm you think you're under?
Tachycardia.
Tachycardia, very good. So now in the tachycardia, we got to determine we have a narrow complex or narrow complex, right? Now, then the next thing is what's the rate?
The rate is well above 180.
Very good. So, and now we got to determine, do we have a stable or unstable? Take care of it. Unstable.
The AFPU is not normal.
Besides the AFPU, right, he is showing signs of shock by having what?
The accessory muscle usage, his breathing, and then also his...
mottled skin, right, pale skin, right, and he's altered, right, very good. So now, use your card, what things would you like to implement in terms of your treatments?
I mean, so we we know he's unstable.
All right.
If he was more stable, we might consider meds, but he's unstable enough that I want to go for a cardiovert.
What's your initial joule setting?
Initial is going to be 0.5 to 1 joules per kilogram.
How much he weighs?
He weighs 50 kilograms. So if we are doing, we'll start with. Do we start at the lower end or the higher end?
You can start at 1. You can
Okay,
start with.
well, so we'll do 50 joules. To start
That's
out
fine.
with.
What is the most important thing when we do this procedure?
Pads have to be on.
Yeah, so put the pads on, right? So we put anterior, posterior, so they don't overlap.
50?
Right, so we're gonna say pads are on, and then the next very critical thing that most of you may fail on, right? What do we have to press? Sync. So go ahead, perfect, right? Everybody see that? Sync is on, right? How much we gotta put this up to? So he said 50, right?
50.
Very good, let's do
1 per
it.
kilogram.
You got it.
All right, we're charging. All right.
And now what we gotta do,
So we are synced. I'm
Yep.
seeing the sync with the R wave. So we're going to clear the patient.
all right?
Cleared.
Mm-hmm.
Shot.
Okay, we're gonna say there's no change in the rhythm.
All right. So next up, we're going to go 2 joules per kilogram.
Very good.
That's going to put him up at 100. So we're going to, again, make sure it's synced. Charge. And we've shot to 200 joules.
Right, before you shock, you wanna say,
We're all clear.
we gotta clear, right? If you don't say clear, you will have what? Critical failure.
Toasty
Critical
partner.
failure, right? So now we observe the monitor for evidence of electrical cardioversion. So do we have change in the rhythm?
The rhythm has changed. Let me
Okay.
see if the mechanical pulse matches the.
Yeah, it does match.
All right, so we're at 120. 120 puts us within the safe range for a child.
All right.
Now we got to treat for shock.
Okay, so what would you, remember the moment you cardiovert, what is the thing we gotta do?
Reassess.
Reassess, perfect. What we
So I want to
reassessing?
get a complete set of vitals on him.
Very good. So the following vital signs. Blood pressure 100/60. Heart rate is 104 per minute. Respiratory rate is now 28 per minute and 100% via BVM. And you notice patient's becoming a little more alert and he's kind of trying to move his hand towards the BVM and swap it away.
Okay. If the patient's not tolerating the VM, let's just switch him to a non-rebreather.
Okay.
15 per minute.
All right.
I worry that he may be in some sort of shock, so let's worry about his temperature control, keep him warm. And what's his, I never asked, but what's his BGL?
Okay, good. BGL, we're gonna say is 100 milligrams per deciliter.
Okay.
Very important. When you have an AMS, right, always wanna check sugar. Good. And then what else we talked about in the previous case that I said we also wanna do in your secondary assessment?
Secondary, we want to, oh shoot. What else is there?
Tell me all
The physical assessment.
physical assessment,
There we
right? So let's do the physical assessment.
So eyes, nose,
Yeah.
airway.
We're gonna say no signs of trauma. You see head, eyes, ears, nose, and throat. No abnormalities. And now, right, we're gonna go down the trunk. We want to reassess what?
The accessory muscle usage, work
Yeah.
breathing.
Yeah, we're gonna say you have scattered crackles still at the bases on auscultation.
Okay. And front and back and bilaterally.
We're gonna say you notice there's no trauma. Back is unremarkable. Liver not palpable below the costal margin. He has cool skin at the extremities, and we're gonna say no other trauma noted anywhere. Right. Also, there's parents here. That anything you want to ask them about, right?
Medical history.
There you go. Right. So sample history, right? So it's asking the question.
So I've got signs and symptoms of what was he doing and
He was playing in the room, and then we noticed he had altered mental status, and he was not really talking to us.
Okay. Allergies,
He has no known allergies.
medications.
He doesn't take any medicines.
No past medical history.
He had a history of this episode of racing heart about 4 years ago.
What happened then?
He went to the hospital and he was treated.
Do you remember what they treated him for? Did they give him any medications for it?
We don't recall.
Okay. And last oral intake.
About 6 hours ago, he had breakfast.
Okay. And events leading up to is more of a.
Yeah, he was playing. We noticed this about 30 minutes ago.
Got it.
So now with the sample, with the physical exam, we did our follow-up vitals. Tell me what follow-up vitals that they are within normal range, abnormal range.
They're in normal range.
Okay. And so now we have perfusion, right? So what do you?
I mean, he reassesses mental status also.
Yeah. We're gonna say his mental status is improved. He does open his eyes to voice.
Let me get a 12 lead on him just to
Okay.
be thorough.
All right. We're gonna say there is no changes in terms of UST segments. We're gonna see sinus tachycardia.
Just sinus that across the board.
Mm-hmm.
Got it.
Which hospital would you like to transfer him?
I'm suspecting infection at this point,
Okay.
or something that's going to drive the
So why are we suspecting infection?
the lung sounds bilaterally. I mean the altered mental status could be the effect of the hypoxia from the lung sounds, but then also with the elevated heart rate. That's a possible sign for a respiratory infection going
Okay.
on.
All right.
Bronchiolitis?
All right. So probably he may have evidence of something going on with his heart. Maybe he has some congenital abnormalities or something is going on that's predisposing him. But his inherent problem was supraventricular tachycardia that caused the abnormal. Right. I wouldn't say he has some sort of infection. His temperature is listed 37.6, so he's not.
So it's normal range.
Yeah, he's not. It's a bit high, but it's not 100.4, 99.7. So SVT, right? But we corrected this. Perfusion improved, right? In terms of what you want to do is do a full set of vital signs, reassess mental status. You want to do a 12 EKG, which you did, making sure your blood glucose is within range, right? And then rule out possibility of trauma, and then you want to transfer him to a hospital setting, right, where they can assess him further. You definitely want to keep him on the cardiac monitor, right, and monitor.
Continue to reassess.
Yeah, if he has any additional arrhythmias, right, you want to be cognizant. By the way, just so we are on the same page, if he was stable, he was alert, he had the same rhythm, and his blood pressure was within normal limits, you would give medications. And you want to know what medicines were given? Adenosine. What's the dose for it?
0.1 milligrams.
Initial dose is 0.1 milligrams, max dose of 6. Second dose is 0.2, max dose 12. Very good. And if that doesn't work, then you could consider doing electrical therapy, right? Which is initial joule setting 0.5 to 1. Second joule setting is 2. 0.5 to 1 is initial, 2 is secondary, right? Good. How do you feel you did as a team leader? Yeah, I think in terms of delegation, I think you assigned tasks. You assessed correct that it was unstable, right? And I heard somebody say give fluids, which is incorrect, right? We do not give fluids for SVT. We will perform. Yeah, correct. Any questions? No questions? All right, you guys are good.
You also